Hey guys, Dr. Ben here, F8 Wealth Centers. Welcome. Go ahead and pop down below where you guys are watching from. And if you are dealing with any autoimmune conditions, would love to hear that. But today I'm going to get in depth into how people, whether that's our patients or just people in general, are reversing their autoimmune condition. And this is something that we get to see all the time. And a lot of people, though, they go, well, it's just in remission, or oh, it's going to come back, or it's just in a my mom had MS and it would go into these flares, and then it would kind of calm down, but then it would flare up, and each time it would be worse and worse and worse. So pop down below, let me know if you're dealing with autoimmune, if you or a loved one are, and what you are doing about it. So autoimmune, this is so near and dear to my heart. Hey Nance, good to see you. This is so near and dear to my heart. My mom had MS. I saw her go through the whole shebang of having to go on disability, having to get a cane, a wheelchair, basically losing her life like she wanted to. Hey Megan, good to see you. Just found out. Absolutely. So pay attention. Everything I'm going to be saying here today, these are things that you can take massive action on. So my mom got to that point. She was in a wheelchair. We were like, man, this is going to be how she's going to go. Probably, 5-10 years. She's not even going to be around. And this was like 25 years ago. She's now 79 years old. She does Granny Boot Camp. She was just over yesterday playing with the kids, does all these things, and does not have MS anymore. My wife had autoimmune to her platelets. They took out her spleen. She had autoimmune to her brain, all types of different things. And now she doesn't. She works out 6 days a week. She does phenomenal things all the time, takes care of the 4 boys, birthed out 4 9-pound babies, all types of different things. And I get to see this every single day in our practice as well. We get to see patients reverse their autoimmune, and not just, hey, let's kind of put it on squash, because here's the deal. In the traditional medical model, what happens? Well, they're going to put people on immunosuppressants. They're going to try to suppress that immune system. Hey, Rhonda, good to see you. I'm almost at chair stage. Yeah, praying for you, Rhonda. Pay attention. There are things you can do on here. I've got, Brittany just put it up there, but check out the YouTube channel. I've got tons of videos on there as well. And you can go through an autoimmune and pick any one of those and just start listening and learning and making some massive changes. So we get to see this with patients that autoimmune, 190 named autoimmune conditions, 3rd leading cause of death when you lump them all together. Why would we lump them all together? Because what I'm going to show you is these are very, very connected. And then if you calm down one side of this and this inflammatory process, then that autoimmune is going to calm down. And a lot of people, the average person that has one autoimmune, they have multiple autoimmune. So let's jump into this, guys. I'm going to show you exactly what we're looking at when we start talking about this autoimmune process here. So autoimmune, and it doesn't matter which one we're dealing with, whether that's MS, whether that's lupus, Sjogren's, mixed connective tissue disorder, alopecia, any type of Crohn's, ulcerative colitis, any type of autoimmune, it does not matter. We've got to come from this perspective of, okay, the body's going haywire. Why would the body attack its own tissue? So we have these cells in our bodies, these antibodies that are going to target certain things for destruction. So normally that would be a virus, that would be a bacteria, parasite, any number of bad things that come into the body. Our body's going to make these. Thanks for the share there, Marissa. So yeah, anybody that you know that's got autoimmune, share this down below. I'm going to get in depth into exactly what you guys need to be doing, how you need to be working on this. So here we go. So we've got the autoimmune, and doesn't matter what the autoimmune condition is, because those antibodies now, instead of attacking or targeting the bacteria, parasites, any of those things, it's actually tagging our own cells. So if you have rheumatoid arthritis, it's tagging your joint. If you have MS, it's tagging your nerve, and then your immune system comes in and destroys that. So what we have to do is we have to figure out why the body's going haywire. In the traditional medical model, they say, oh, it's the immune system. squash it, immunosuppress it. Prednisone. Anybody like prednisone? Probably not. Give me a thumbs down if any of you have been on there. Hey, Melissa, good to see you. Melissa, yep, your daughter, 16-year-old, also has elevated TPO antibodies. She has Hashimoto's as well. You have to look at it that same way, and you've got to calm all of those things down. We see so many young women. One of the things I've drawn off of here is going to be estrogenic events. Young women going through puberty are going to drive this autoimmune reaction. So your body is attacking its own tissue. They put you on prednisone, methotrexate, which is low-dose chemo. They'll put you on Humira, $10,000 a month. And that was like 5 years ago. It's probably even more than that now. And yet none of those are fixing the why. And so this is why we have to get this done. What about high blood count? If we're talking about white blood cell count, Megan, I'm going to show you what that means here in a second with that immune system. So we start drawing these lines off of here, and all of these different things can drive this immune inflammatory cascade. So one of the first ones we look at are the adrenal glands. So the adrenals are our stress glands. These are going to respond to stress of all different types. Jobs and cars and kids and COVID and presidents and gas prices and whatever you want to stress about. And a lot of times, if somebody has had a stressful event, like one big time thing, or they've had a year of taking care of grandma as she passes away, any number of different things can drive these adrenals, and that can stimulate that elevated cortisol. All these things can stimulate that immune system to get more revved up. So the adrenals are a big, big part of this, and that's why it's so important that we deal with those stressors in our life. It's a huge part of this process. Number two here is going to be blood sugar. Many of you guys have heard me talk about blood sugar. If you listen to my masterclass, I went super in depth into this, but how does it drive this autoimmune? Actually, one of the biggest reasons is it will be the number one stressor to the adrenal glands. So the highs and the lows are both going to be stressful. So the highs is going to stimulate this insulin to go around in the body. That insulin is inflammatory. It's going to drive this autoimmune. The low is going to stimulate those adrenals to kick the liver, and then the liver is going to release glucose into the bloodstream. So every time your blood sugar goes up too high or down too low, you are going to stimulate more autoimmune. And this is just how it happens. Rhonda, you make so much sense. PTSD diagnosed 2 years ago after having thyroid nodules out. Yeah, we see it all the time. I started the CGM yesterday. My phone alerted me at 5:15 this morning, and CGM said 59. I did the finger prick, and it was 109. I felt bad, so leaning towards the CGM, but that's, yep. Heather, here's the deal. There is, and we'll get to that. So which is more accurate, the finger prick or the CGM when we're talking about blood sugar? It could be one or both. At nighttime, one of the things you got to be aware of is it pushing on the onto that muscle? Is it pushing onto that? Like, are you sleeping like this? Sometimes it will go at that point. Sometimes you're not washing your fingers well enough. So you've got to just start seeing where it is. If you went from 59 and then all of a sudden it was back up to 100, it probably was inaccurate from that pressure on there. But otherwise, it could have been that you were low and now the body had released that glucose and it's starting to go up as well. So blood sugar swings. Dr. Krasnian, he's the godfather of Hashimoto's. He says every time that blood sugar goes up too high or down too low, you're revving up that immune response and you're destroying more tissue. Vitamin D is another one that is so important. Vitamin D is huge for immune system modulation. So it's going to turn that immune system up and turn it down at the right time. Vitamin D, if you have autoimmune, you need to be closer to 80. So a lot of the labs say 30 is good. Most people think 60 is good, but if you have autoimmune, you've got to be closer to 80 level on their vitamin D. Great, get outside, but for most people, they're not getting enough. And The another one, what we were just talking about with the 16-year-old, estrogenic events. So this is going to be if somebody is having a major estrogen swing, higher or lower, this is going to potentially drive autoimmune. So what does that mean? Well, puberty, going on birth control pill, getting pregnant, having a baby, going through menopause, going through hormone replacement, any of these different things. We find teenage girls every year with Hashimoto's, and that is driven by this estrogenic event from that puberty swing. So you've got to make sure your liver is clearing out the hormones like it needs to, that you're not going on a bunch of estrogen. Hormone replacement can do it, all of those different things. So liver, very, very important. And then we have infections can drive autoimmune. And we know that, and if you look up Epstein-Barr virus, there's at least 7 or 8 of the main autoimmune conditions that are going to be driving autoimmune. So these 7 or 8 main autoimmune, the Epstein-Barr virus is going to be one of the big ones that is driving that autoimmune. So look for, and this is one of the things Megan was asking about, their high white blood cell count, chronic infection. If that infection is revved up and go, it will drive this immune system, and then that immune system's on red alert, and hey, might as well start attacking my own tissue. So if you have elevated white blood cell count, you've got to get that immune system dialed in. You've got to get it calmed down. You've got to deal with whatever infection your body has. So it could be, so here's what you look for, Megan. If your lymphocytes are over 38%, it's viral. If your neutrophils are over 58, 60%, it's bacterial. So that's what you've got to look at. If it's bacterial, it could be in your mouth. You could have a gum infection. You could have something like that. You could have bad bacteria in the gut. You could have bacteria sinus infection. If it's viral, that's going to be more of the Epstein-Barr virus, something along those lines. So we've got to deal with that infection. We've got to build up the immune system and then kill off any of the bad stuff as well. Environmental issues is another big part that we look at. So that could be moving into a moldy house, having a moldy basement, having a leak in your shower, and there's mold back behind that. If you've got in the wall that keeps coming out and you spray some Kills or you paint over it and then it comes back again, that's wet on the other side. For 25% of the population, that's going to drive that immune system and can stimulate that autoimmune. Environmental. I had a young lady a couple of years ago that worked in the windmill factory where they make those big windmills that make a little bit of energy but really aren't that effective. She was in the paint department where you can imagine these things are up in Wyoming where it's negative 40 and windy and snow and all this stuff, and so that paint has to be ridiculously strong, and so it was very toxic. She started attacking her own liver. She was on the liver transplant list at like 23 years old, and we were able to reverse that, got her off, got her out of that environment, detoxed, and now she got to keep her liver and is functioning very, very well. So environmental toxins can be a big part of it as well. Then we get into leaky gut, and leaky gut is going to be, sounds like this kind of new agey type term, but leaky gut is going to be the small intestine lining, and it's going to keep certain things out and allow certain things in with that small intestine lining. But if we have leaky gut, then things are able to get into that bloodstream too soon, especially food allergens, things like that. That is going to drive this entire autoimmune cascade in the body. And so leaky gut, we've got to work on that gut lining. You've got to get rid of food allergens. You've got to get rid of pathogens, bad bacteria, yeast, things like that. You've got to take the probiotics then. You've got to use glutamine, marshmallow root, aloe vera juice, things to heal up that gut lining. You need to replace any enzymes, stomach acid, anything to help digest foods. And that is how you're going to start healing up your leaky gut. I've got a bunch more videos on YouTube talking specifically about leaky gut if you want to jump on there. And then we start thinking about food allergies. especially gluten. So gluten, if you have Hashimoto's, 100% you need to be off of any type of gluten. But it could also be dairy, corn, soy. Look for anything that could drive this immune inflammatory cascade, and those food allergies can be a big part of it. For Hashimoto's, autoimmune thyroid, every time somebody eats gluten, if they have a gluten issue with that, it can drive this destruction for upwards of 6 months every time somebody ingests it. So this is huge. This is, if you could do this with every single one of these, clear it out, make sure it's working as well as possible, you would have phenomenal changes in your autoimmune. So you or a loved one have the ability to heal. Guaranteed 100%. Well, if you've had destruction of your joint and it's actually damaged, will it ever go back to normal? Maybe not. If you have type 1 diabetes and you have that autoimmune there, will your pancreas start making insulin again? Probably not. And yet, if you're type 1 diabetic and you did not fix why your body started attacking its own pancreas, you are going to have another autoimmune. You are still going to have this inflammatory cascade. You're never going to be stabilized like you need to. So you need to go through each and every one of these, evaluate them. If you're not getting the results that you need, if you need support in this process, click that link. Brittany just put that in there. You can schedule that Calendly call, 30-minute call. We'll sit down with you. These are free, and we'll just go over what the process looks like. See if you're a good fit. See if you can heal this autoimmune, and if you're willing to do the things that you need to do to get it done, because we get to see it. MS reversal, RA reversal, lupus reversal, all these magical things happen when you start doing this work. So love having you guys on. If you have any more specific questions, let us know. But your bodies can absolutely heal. We get to see it all the time. I got to see it with my mom, got to see it with my wife, and I would love to help you if you need anything at all. Drop us a line. Okay, guys, take care. Have a great day.